Well, first of all, there's, at this hospital especially, but in many children's hospitals, but this hospital, Children's Hospital in Boston, has a very long tradition of expecting its staff to try to improve the field, especially the chiefs of service. That goes way back to my predecessor, Dr. Gross, and his Dr. Ladd, to try to figure out some of these problems. So we see all the time diseases that are not treatable, and then we have a big laboratory, and we bring back these clues to the scientists, and one after another, many of these are being solved. For example, we're working with the neurosurgeons here to see if you can treat hydrocephalus, the fluid in the brain in little babies, in addition to the tubes that are put in, but can you turn off the leaking of the blood vessels by using angiogenesis inhibitors that do that. We're working with the neonatologists, for example, Ann Hansen, to see if we can prevent the problems that premature babies have. 5% of them have hemorrhages in their brain all over the world, and about 5 or 8% of them have blood vessels in their eye, retinopathy of prematurity. And so we now have clinical trials in both of those areas, hydrocephalus and in premature babies. And then Mark Pewter, for example, who worked here, has built on some research done earlier by Robert Schamberger. He's now our chief of surgery, but when he was a resident, he worked in the laboratory and was trying to solve the problem of why little babies who can't eat because the intestine is obstructed and being operated on, and they're getting intravenous feedings, long-term intravenous feedings, but they become jaundiced and sometimes actually end up dying or needing a liver transplant. And he developed an animal model to reproduce that. And when Mark Pewter finished his surgical training in pediatric surgery, he was the chief resident in pediatric surgery, he wanted to do 2 years in the lab. So he came here and he discovered how to solve that problem. And it's a simple deficiency of omega-3 fatty acids, and now it's being solved in this hospital and many other children's hospitals. So one after another, one sees these changes.